sounds like a lot of what you focus on is really patient facing,
Mhm.
um, or facing the families or people affected by breast cancer. Do you, as an organization, also do advocacy and lobbying when it comes to health, policy,
Right.
and going to Capitol Hill and
Yeah.
fighting for what women need to do the very best they can once they get diagnosed? Do you also take part in those activities?
Yes, we do. We have not been as, I guess maybe the word would be strategic as we would like. But we have just started developing a state policy initiative. And we're going to start at that level to really penetrate where we have that greatest presence. So you'll be seeing some very, focused state policy work on behalf of the organizations, and then that will bubble up to our federal, um, interest in policy. We have been, we worked with the National Black State Legislators Association, and we presented there in Las Vegas at their national convention last year on TNBC and Black women. And that was all the Black state legislators from across the country. So we're going to start doing some roundtables with those individuals in the states that we have a strong presence initially, and doing some advocacy training, and preparing a toolkit for our survivors and our ambassadors who are working on behalf of the organization. So yes, you will see more intentional and strategic advocacy work on the state and federal level.
That's great. And are you also at the same time, maybe in the same way, partnering with the medical centers or the oncology practices?
For
Yes.
sure, for sure. We, of course, we're in the, the beautiful Texas Medical Center that we have here in Houston, Texas. We're very fortunate to have, MD Anderson and Methodist and Baylor, et cetera. And then, we partner, like, we worked with you with Dana-Farber when you were so gracious to do a webinar with us. So we work with Will Cornell out of New York, and the different, just the different medical institutions around the country that we have sourced different medical experts to share their expertise with our ladies, that have reached out to us to be part of some of their research. We are constantly being referred by different medical institutions, as well as national cancer and breast cancer organizations from, the American Cancer Society, the National Breast Cancer Coalition. When women contact those organizations, they are funneling them back to Sisters Network as a resource of support and, support emotionally and also financially through our breast cancer assistance program, which is a national program where we provide financial assistance to survivors. And then we also pay for mammograms and or ultrasounds for women who are underinsured or uninsured. And we get referrals from Komen, we get referrals from, like I said, ACS. And I think that speaks to the respect and the regard for the important work and the place and the space that we have made ourselves, as a viable and important organization in that space.
And so if patients want to learn about all the support and community, programming going on, would they just go to your website? Are things
Absolutely.
signed up
Our
there?
website, they can visit sistersnetworkinc.org. We're on all social medias, and all you have to look up is Sisters Network and you'll find us. And we're very responsive. We want to help the ladies. We want them to feel supported. Breast cancer is in no one's budget. So that's why we have the financial assistance program. Of course, there's never enough funds to help the ladies, but what we try to do what we can with utilities and, paying towards their rent or mortgage. We don't pay medical co-pays. But we try to take care of some of the basics to help them during this very difficult time.
And I know there's also been a huge push on clinical trials and increasing awareness and education around clinical trials, which is an incredibly important part of our cancer care and advancing the
Absolutely.
field of cancer. And I really appreciate that because I think there's a lot of um, of work that we need to do as a medical community to make our trials more diverse and more representative of the patients who we see in the clinics and who we're treating and who need us the most.
Yeah.
And I just really appreciate that focus on a national scale. It's really elevated it.
Yeah, and I appreciate, you lending your expertise in, because clinical trials are so important, and because it's like you can't tell them enough in terms of educating and just and kind of tearing down some of those fears that people have from, the Tuskegee and the Henrietta Lacks, et cetera. So we have a new initiative, and since last time I spoke to you, it's called Color of Trials. And so all of our clinical trial outreach and advocacy work falls under that. And so it's been really good. We're pulling together some really good programming around that topic and making sure that the ladies are really empowered and educated so they understand that we need them in those trials so that the medicine can be reflective of their DNA, and we need their help. And so it's an ongoing conversation, and but we're making headway. And we also just recently partnered with breastcancertrials.org, where we have a clinical trial navigator who has appointments to help a person navigate that process through BCT. So, we're trying to be very thoughtful in how we're approaching it and making it that concierge service, if you will, for the ladies. At the end of the day, we just got to make it happen.
Yeah, that's amazing. I mean, you're really taking it to the patient, which I think is so necessary to put it
Absolutely.
on their level and to make them understand how much it's important to them, right?
Yes, yes.
Um, so I guess in closing, I just wanted to ask you if you could, this is a hard question, but if you
Okay.
could have anything you needed to make our disparities go away and to eliminate barriers, is there anything that comes to mind as something that would be most important to provide for patients once they have a diagnosis of breast cancer?
I think two things. Sorry.
Okay,
One
two's good.
is one thing we would like to see for the patients is that the guidelines be revisited. So that if Black women are 42% more likely to be diagnosed with breast cancer and under 35 are 2 times more likely to be diagnosed with breast cancer as compared to other ethnic groups, there's a breast cancer crisis. And so we as an organization, when you talked about policy work, we are going to be looking at having that conversation about, can we revisit these guidelines? 40 is it's too old. We need to look at 35, preferably even 30 for your first baseline, so that we can save more lives. By the time they go at 40, that's why we're dying more frequently, and then we're having more aggressive cancers. So that's going to be very important to us. Once you're diagnosed, we just need to continue to provide the financial assistance to these ladies so that they can get the proper care and also some financial relief for them. And that's where, like I said, our breast cancer assistance program, we use our Stop the Silence Walk to help fund that, as well as we do get some grant funding, but it's never enough. And we have to open and close it constantly to help these ladies. So we provide that sisterhood, but we need more resources to help the ladies with the financial assistance. We wish we had enough funds to be able to do the prosthesis, help them with, the sleeve for lymphedema. Those are real problems with real expenses that sometimes the insurance covers or doesn't cover enough. And so we as an organization would love to be able to help the ladies in a stronger and more robust capacity for that.
Yeah, absolutely. Not just extending their life, but improving the quality of
Quality.
their life after a breast cancer diagnosis. I think you raised some really important points, and the work of your organization is so important. Thanks for all that you're doing,
Thank
um,
you.
and moving this work forward. And thanks for taking the time to chat with me today.